अस्सलामुअलैकुम, आप देख रहे हैं कनाडा का सबसे मकबूल तरीन टेलीविजन प्राइम कैनेडा टीवी और प्रोग्राम कनाडा हाइलाइट्स के साथ मैं हूं आपका मेज़बान मोहम्मद उमर खान। नाज़रीन, आज कनाडा हाइलाइट में हम जिक्र करेंगे कनाडा की ताज़ा तरीन सूरत हाल का। और कनाडा में फेडरल इलेक्शन के बाद अब फोकस हो रहा है कोविड के ऊपर, क्योंकि कोविड एक मरतबा फिर सर उठाता हुआ दिखाई दे रहा है और तमाम ही प्रोविंसेस के अंदर कोविड से निपटने के लिए जो हेल्थ डिपार्टमेंट है वो एक्टिव हो चुका है। तो आज के प्रोग्राम स्पेसिफिकली कोविड से मुतालिक जो अपडेट्स हैं और जो कनाडा की सिचुएशन है और आने वाले दिनों में जो कुछ इकदाम होने जा रहे हैं उससे मुतालिक है। और आज हम आपको ये बताएंगे आगाज़ में ओंटारियो से मुतालिक। ओंटारियो, न्यू ब्रंसविक, मैनिटोबा और सस्केचुवान में सेहत की देखभाल करने वाले जो स्टाफ मेंबरान हैं उनके लिए लाजमी वैक्सीन का हुक्म सादिर हो चुका है। और ये बताया गया कि जो मुलाजमीन इन सूबों में वैक्सीन ना करवाने का इंतखाब करते हैं उनके खिलाफ कार्रवाई भी होगी, बजाय इसके कि वो अपना बाकायदगी के साथ टेस्ट करवाएं। और टेस्ट करवाने के साथ साथ वैक्सीनेशन को ज़रूरी करार दिया गया है। और क्यूबिक और इसके अलावा अल्बर्टा और ब्रिटिश कोलंबिया में वैक्सीन लेने से इनकार करने वाले लोगों को ये कहा गया है कि उन्हें बिला मुआवजा रखा जा सकता है। और ये भी बताया गया है कि उन्हें मअतल भी किया जा सकता है, यानी उनके मुआवजे बंद हो सकते हैं, उन्हें मअतल किया जा सकता है, सस्पेंड हो सकते हैं लोग। क्यूबिक के हेल्थ केयर वर्कर्स के पास जो हतमी डेडलाइन आई है वो 15 अक्टूबर की आई है, यानी 15 अक्टूबर तक क्यूबिक में रहने वाले लोग और ये हेल्थ स्टाफ जो है, स्पेशली जो सेहत की देखभाल का स्टाफ है, इनको वैक्सीनेट होना पड़ेगा। और इस हवाले से माइक आर्मस्ट्रांग ने एक रिपोर्ट में बताया है कि कितने ऐसे स्टाफ मेंबरान हैं जो हेल्थ स्टाफ में काउंट होते हैं बट वो वैक्सीनेटेड नहीं है, लिहाजा वो अमला अपने आप को तैयार कर ले वैक्सीनेशन के लिए। और ये भी बता दिया गया कि अगर अब वो ऐसा नहीं करेंगे 15 अक्टूबर के बाद ये सख्त स्टेप्स लिए जाएंगे। और जिन इलाकों का नाम आया है, जिन प्रोविंसेस का नाम है इसमें, जिन जगहों का नाम है उसमें क्यूबिक भी शामिल है, नोवा स्कॉटिया भी शामिल है, अल्बर्टा, ब्रिटिश कोलंबिया और अल्बर्टा के अलावा ओंटारियो के से मतलब आप भी समझ लेंगे न्यू ब्रंसविक, मैनिटोबा, सस्केचुवान, तमाम ही वो जगहें जहाँ पे ये सेहत के लोग या वॉलंटियर्स या ये तमाम अफराद जो काम करेंगे या तो वो सस्पेंड हो जाएंगे अगर ये वैक्सीनेट नहीं होते, या फिर उन्हें निकाल दिया जाएगा, या फिर ये कह लें कि उनका मुआवजा बंद कर दिया जाएगा। मजीद इस हवाले से देखें इस रिपोर्ट।
After 18 months of strain, Quebec's healthcare system may be looking at a little more just around the corner. The clock is ticking down to the October 15th deadline for healthcare workers to be vaccinated, and some are warning that mandate won't come without a cost.
Our biggest worry right now is that we won't have enough staff to give proper care to the population.
Christina Hoare is with the Nurses Union. She represents about 3,400 nurses in the regional health board that covers Montreal's West Island. Right now, Hoare says about 7% of her members aren't vaccinated, but that in the middle of a pandemic, they can't afford to lose them.
Right now, with those 7% on the floor, we're missing staff at a critical level. So removing 7% more is just going to make things a whole lot worse.
They will not be able to work.
Quebec's health minister says the province isn't changing its mind. Christian Dubé says about 16,000 healthcare workers still aren't vaccinated, but he says things are going in the right direction. 300 to 400 healthcare workers are getting their first dose each day.
If they get their first dose immediately over the next few days, the penalty of not receiving their salary will be limited.
Now, speed is one of the criticisms out there. Some of the health unions say they support the vaccination mandate, but that the deadline was too quick. They say it's left members nervous. The pressure they're feeling is about to get worse.
Obviously, that's a worry. People have been working at 150% since a year and a half now.
It will have an impact, but it's not going to be like huge. I mean,
Dr. Gilbert Boucher represents emergency medicine specialists. He says contingencies are already being made to work around the people who'll be missing. But Boucher says the mandate is needed to protect patients. A vaccinated doctor or nurse can still catch COVID and be contagious, but much more so if they're unvaccinated.
when we do testing on people, I mean, if you're double vaccinated, you're infected, we detect a little bit of virus. But if you're not vaccinated, it's millions and millions of virion you're shooting everywhere.
Letters are going out right now in Quebec to unvaccinated healthcare workers. The health minister says it's to make it clear the mandate is happening and they're going to be without a paycheck.
अब हम आपको बताएं ब्रिटिश कोलंबिया के हवाले से, जहां पर वजीर सेहत एड्रियन डिक्स ने ये ऐलान किया है कि वजारत तालीम कोविड-19 वैक्सीन के मैंडेट पर फैसला करने के लिए फौरी तौर पर एक कमेटी बना रही है। और एक प्रेस कॉन्फ्रेंस के दौरान एड्रियन डिक्स ने कहा कि हुकूमत जानती है कि स्कूल्स में वैक्सीन के मैंडेट की ख्वाहिश है। वजीर तालीम जेनिफर वाइटसाइड ने इस वक्त एक ग्रुप तश्कील दे दिया है और वो इस बात को यकीनी बनाना चाह रहे हैं कि असातिज़े स्कूल के अमले और जो दीगर लोग वहाँ पे नॉन टीचिंग स्टाफ भी है उसके लिए वैक्सीन को लाजमी करार दे रहे हैं और ये एक मसला भी बन रहा है, इसको हल किया जाना चाहिए। ये ऐलान बाद में किया जाएगा कि जो लोग सूबे में तवील मुद्दती निगहदाश्त के घरों में मुलाजिम हैं उनके लिए क्या होना चाहिए। 12 अक्टूबर की आखिरी डेडलाइन है इन तमाम तर लोगों के लिए जो स्कूल का स्टाफ है, टीचिंग या नॉन टीचिंग स्टाफ। और प्रोविंशियल हेल्थ ऑफिसर ने डॉक्टर बोनी हेनरी ने ये बताया है ट्यूसडे को कि 12 से 26 अक्टूबर के दरमियान जो ऐसे लोग होते हैं जो ये कह लें कि जिन्हें डेली वेजेस पर हायर किया जाता है उनके लिए कम से कम एक वैक्सीन की खुराक होना ज़रूरी है और वैक्सीन के बाद कम से कम 7 दिन वो काम करें और उसके बाद वो अपनी पहली खुराक के 35 दिन के अंदर अंदर दूसरी खुराक की जानिब बढ़ें, यानी 5 वीक्स के अंदर जो है उन्हें अपनी सेकंड डोज ले लेनी चाहिए। तो ब्रिटिश कोलंबिया के हवाले से बात है और मजीद इस हवाले से क्या कहा देखते हैं।
I was doubting myself a lot, didn't feel like I could meet challenges head on the way that I usually could.
Amber Smith hit an emotional wall in February. She says it was taking a toll on her work and her personal relationships. So she tried something she's never done before. She started seeing a psychologist.
It's been, tough to feel isolated and like you don't have access to your friends and family in the way that you would. It was really hard to just feel like yourself.
Millennials and Gen Z are most likely to admit it's a struggle.
When you ask them to self-report their level of mental health, they are more likely to report it as poor or bad compared to their older counterparts.
There's been a huge spike in virtual therapy sessions at the Ontario Shores Centre for Mental Health, mirroring a trend seen right across the country.
We used to do about 400 virtual care visits a month pre-pandemic, and we are now doing anywhere between 4,000 and 6,000 virtual care visits a month.
Given how competitive the labor market has become, employers who want to keep and attract the best workers need to consider offering mental health benefits if they don't already and increasing caps.
The majority of the plans still provide a fairly modest amount, maybe $500 a year in support for that type of coverage. And so, depending on your personal needs, it may not be enough.
I also value an employer, though, who creates an environment, like a workplace of well-being, where I know I can come to work and I can find support on those days when I don't feel myself.
The pandemic has raised the bar for mental health support in the workplace.
अल्बर्टा का जिक्र करते हैं जहां पर सूबे के स्कूलों में कोविड-19 के जो ये कह लीजिए कि जो बढ़ रहा है, ट्रांसफ़र हो रहा है, फैल रहा है, इसका सुराग लगाया गया है कि क्यों फैल रहा है। इस वायरस की मुंतकली को कम करने के लिए मजीद इकदामात की ज़रूरत पर भी जोर दिया गया है। प्रीमियर है जैसन कैनी, उनके साथ वज़ीर सेहत जैसन कॉपिंग और वज़ीर तालीम एड्रियाना नालगारिंच और चीफ मेडिकल ऑफिसर हेल्थ डॉक्टर दीना हेंशन ने इन इकदामात का ऐलान किया है। स्कूलों में किए जाने वाली ये इकदामात कोविड-19 के जो फैलने की वजूहात हैं उस पर फोकस होने के बाद हुए हैं और रैपिड टेस्टिंग किट्स भी फराहम करने के साथ साथ जो बालिग हैं उनके लिए यानी एडल्ट्स के लिए कोविड-19 वैक्सीन की पॉलिसीज़ को सबूत के साथ अब देखने का फैसला किया गया है ताकि स्कूल हुकाम की हौसला अफजाई की जा सके। ये भी बताया गया है कि प्रोविंस जो है वो थैंक्स गिविंग के अख्तिताम पर इस हफ्ते से पहले सेहत आमा की पाबंदियों में भी तब्दीलियां लाएगा। सेहत आमा के दीगर तमाम इकदामात अपनी जगह पर मौजूद रहेंगे और 6 अक्टूबर से वो अल्बर्टा के लोग जिनकी उम्र 75 साल से जायद है उन्हें फर्स्ट नेशंस के साथ साथ वो अफराद जिनकी उम्र 65 साल से जायद है, इन तीनों कैटेगरी के लोगों को कोविड-19 की वैक्सीन की अपनी तीसरी खुराक की बुकिंग शुरू कर देनी चाहिए ताकि दूसरी खुराक को अगर इनके 6 माह का वक्त गुजर चुका है तो ये अपनी थर्ड वैक्सीनेशन की तरफ आ जाए। तो इससे साबित होता है कि अगेन ये एक प्रोसेस शुरू हो चुका है। तो अल्बर्टा से इस चीज़ का आगाज़ हो चुका है कि वो अफराद जिन्हें 3 कैटेगरीज में डिवाइड किया गया है, यानी अगर इन्हें ये कहा जाए कि अपनी वैक्सीनेशन को लिए हुए 6 माह का वक्त गुजर चुका है तो अब ये थर्ड डोज की तरफ बढ़ेंगे और ये थर्ड डोज के ज़रिए अपने आप को मज़ीद सेहत की तरफ लेकर आएंगे। और सेहत आमा की जानिब से ये बात बताई गई है। इसमें जो फैसले किए गए हैं ये कोई मजमूई तौर पर कहा जा सकता है कि वज़ीर तालीम और प्रीमियर प्रोविंस के, उसके अलावा जो चीफ मेडिकल ऑफिसर हेल्थ हैं, वजीर सेहत, मुश्तरका तौर पे ये फैसले सामने आए हैं ताकि स्कूल में काम करने वाले लोग और तमाम ही जगहों के जो प्रोविंस के लोग हैं इन सबको फैसिलिटेट किया जा सके। मजीद इसमें क्या बातें हुई देखते हैं।
There's a number of people, as we know, who are in that group who were prioritized to receive vaccines early, and there are a number in that group whose immune systems do not respond as well to vaccines, and we now know that adding a third dose can actually stimulate a response for many people that gives them as much protection, or at least some protection, closer to what people with a strong immune response system have. So these are, today we're expanding to approximately 100,000 people, individuals in British Columbia who will receive an invitation for their third dose. And these are people who are moderately to severely immunocompromised. So in addition to the groups that we talked about 15,000 people about 2 weeks ago, we are now adding people who are on active treatment for solid tumor or hematologic malignancies, so those are blood tumors, since March 2020, who have received or are receiving systemic therapy. So that includes chemotherapy, molecular therapy, immunotherapy, targeted therapies, including CAR-T, monoclonal antibodies, hormonal therapy for cancer, and people who have both solid tumors as well as hematologic cancers, and people who since October 2020 have received or are receiving radiation therapy for cancer. So I know this is a broad group of people, and we have been working under the guidance of Dr. Ballum and Dr. Maureen O'Donnell at PHSA to make sure that we've been in contact with all of your specialists who have identified the people who are receiving these types of therapies, and you'll receive an invite from us in the next few days. In addition, people who have moderate to severe primary immunodeficiencies. These are diseases that we often develop or are born with. So these are combined immune deficiencies affecting T cell, immune dysregulation, particularly things like familial hematophagocitic lymphohistiocytosis. Those of you who have that know what that is. Or those with type 1 interferon defects caused by a number of genetic primary immunodeficiencies, etc. Again, we have been in touch with the specialists who most of you will be seeing to identify you. And in addition, people who have moderate to severe primary immunodeficiency, which has been diagnosed by an immunologist and requires ongoing immunoglobulin replacement therapy, so IVIG or SCIG, or the primary immunodeficiency has a confirmed genetic cause. And these are also more rare diseases like DiGeorge syndrome or Wiskott-Aldrich syndrome. In addition, people who have AIDS-defining illness or CD4 count less than 200 or CD fraction less than 15%, or detectable plasma viral load since January 2021, or HIV infection, and are people who are 65 years of age or older, or perinatally acquired HIV infection. Again, a small group of people that we are connecting to reach out to your care providers and to make sure that you have the opportunity to receive a third dose. There are also another number of biologic agents that can affect our immune system's ability to respond to vaccines. And these are often used to treat people who have autoimmune disorders. And we know there's a lot of confusion that I hear about people with certain autoimmune disorders, whether they can receive a vaccine or not. And to you, I say, absolutely. If you have multiple sclerosis, if you have rheumatoid arthritis, if you have lupus and many other illnesses for which some of these medications are prescribed, you are at higher risk of having severe illness or complications from COVID, and we have seen that across the board. So not only should you be immunized, you are now eligible as well to receive a third dose to make sure that you have a good, strong immune response. So there are a number of biologic agents, and I won't list them all. These will be available on the BC CDC website, on the Immunize BC website, so people can go and find out which ones they are. And in addition, we'll be adding people who since December 15th, 2020 have been treated with oral immune suppressing drugs. Again, drugs like azathioprine and others. And again, those will be listed. and people since December 15th who have been treated with immune-suppressing infusions or injections of things like cyclophosphamide and others. Finally, another group of people who we know don't always mount a good, strong immune response are people who are on dialysis or have severe kidney or renal disease. And again, we have been in contact with your care providers around the province, and we have information on who you are, and you will also be receiving an invite to receive a third dose as part of your primary series. So you will be contacted by the provincial Get Vaccinated system about how and when to book your third dose. And if you believe you meet one of these criteria, and the details will be on the website, and have not been contacted by next week, you can get in touch with your healthcare provider, and we're providing through Doctors of BC and the college an attestation letter that will ensure that you can get your third dose if needed as well. As I shared a couple of weeks ago, people who are much greater at risk of severe illness, and in these two groups, may not have had sufficient immune response to 2 doses. This will bring these people up to the level that the majority of us who have 2 doses have. And so that is an important indication of a way to protect people who are most at risk for severe illness. I know that many people have been asking about third doses for people who are fully vaccinated, yet their vaccines or the combination of their vaccines are not recognized in some countries around the world. All of Canada's vaccines are highly effective in every combination that we have, and I presented data last week that showed that here in BC, and we have similar data from other provinces in British across the country. For those who have taken AstraZeneca, who've taken the vaccine that was offered to you at the first opportunity, you did the right thing. And I thank you for doing that. It has made a tremendous difference in transmission of virus and in protecting both yourself, your family, and your community. And your efforts have helped to reduce the spread of this virus in BC, and the data that we presented last week show that these combinations work and work well. We are now actively working with Health Canada and will continue to work with the Public Health Agency of Canada to make sure that Canada has a single internationally recognized vaccine passport that includes the recognition of these combinations. And I can tell you, my colleagues at the Public Health Agency and Dr. Tam have been meeting with our counterparts in other countries, particularly the US CDC, and I know there's a lot of concern about travel to the US. Right now, there are no vaccine restrictions in traveling to the US by air, and we know they will be updating the requirements in the coming weeks as we get closer to hopefully the land border opening. And we are working very closely with counterparts in the US Centers for Disease Control to make sure that these highly effective combinations are recognized. So please be patient. I will also tell you that we've been working with colleagues in the UK, the European Union, and a number of the important sun destinations that many Canadians go to, including Mexico and the Caribbean, where mixed doses have been a part of the immunization program in many countries, in 19 of the EU countries, for example, and the UK. And these combinations are being recognized by many countries and will continue to do so as the data that we have here in Canada and in other countries shows how effective they are. So please be patient. This is changing rapidly, and we know that we will have updates on this in the coming weeks. I will also say that the WHO has been reviewing data on mixed and max combinations because it is important for the global pandemic response as well. And as part of that, I want to report that BC will be returning 300,000 doses of mostly Moderna vaccine to the federal government, to our procurer. These vaccines are not required at this time right now in BC, and we still have a large number of vaccines that are available to meet our needs over the next few months. And these vaccines will be part of the Canadian donation to the COVAX initiative. It is incredibly important for all of us in BC and in Canada that people around the world are vaccinated and protected against this virus. That is the only way that we will get out of this global pandemic, and it's important that we do our part to support that as well. We can be proud that we are doing that here in BC. In terms of our ongoing pandemic management, as I have indicated a number of weeks ago, we have an order coming out around requirements for vaccination for all workers in long-term care and assisted living. And I'd like to provide an update on that here today. That order comes into effect next Tuesday, October 13th. And the order in its details will be published on our website today. And there has been some modifications of it that are important. People hired between October 12th and 26th must have a single dose of vaccine and be at least 7 days post that dose and follow additional preventive measures, and must get their second dose within 28 to 35 days after that first dose. So people who receive their first dose prior to next Tuesday will be able to continue to work following these preventive measures, but they must commit and receive their second dose by 35 days after their first dose. This is recognizing that it is important for us to have people who are vaccinated working in these high-risk settings. And we encourage every single person in long-term care. We know the vaccination rates are high, but in some places they are not yet high enough. It is not too late to protect yourself, to protect your family, to protect those we care for, and the workers that we work with.
A second. In Vancouver Island, 97% have received a first dose, 94% a second. And in Northern Health, 93% have received a first dose, and 87% have received a second. We'll be sharing more data on this later this week when the data is finalized, but that tells you where we are. That represents, those percentages represent about 46,000 healthcare workers. And I want to note to everybody, and Dr. Henry has been clear about this, that this group of people, the group of people we're talking about, has done extraordinary work in this pandemic. Their generosity, their commitment, their dedication is something that we are all honored and proud of. And this is another step in that journey. It's a provincial health order to get vaccinated. And so if there are people who are currently unvaccinated, at the end of day, on October 12th, they will be going on leave of absence without pay. And as Dr. Henry has said, there will only be medical exemptions from that. And so now is the time to get vaccinated, to not have that happen, but as well to support the efforts that are so important in long-term care to ensure that everyone is protected. I'm so proud of our workers in long-term care. I'm very proud of these levels of vaccination, which shows the commitment of people in long-term care to the safety of residents and the safety of the community. And we have the opportunity in the coming days to do even better. And I encourage everybody to do so. As I reported last week, as COVID-19 cases declined over the summer, we went at the height of the second wave to more than 10,000 active cases. We went down to under 1,000 for a period, and now we're back at around 6,000 cases. Health authorities redeployed some contact tracers to support vaccination or other public health efforts, while others returned to their base positions, including acute care and others other areas that needed support in the healthcare system. In the weeks since, health authorities have refined their initial data on individuals who have returned to contact tracing positions and have added additional staff, bringing to 1,396 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October the 4th. That's 504 in Fraser Health, 195 in Interior Health, 152 in Northern Health, 188 in Vancouver Coastal Health, 119 in Vancouver Island Health, and 238 in the Provincial Health Services Authority. Each of these health authorities continues to add additional contact tracers, and I will continue to report on that progress in the coming weeks. I want to briefly speak to issues around ICU and hospital capacity today. As you're aware from previous briefings, we have 9,218 base beds in our healthcare system, and a further 2,353 surge beds across the healthcare system. And today, base bed occupancy rate is 94.3%, surge bed occupancy rate is 15.3%. So to put that in context, in terms of our overall health system capacity, as of today, 9,052 people are in hospital overall in BC. That number on September 3rd, a month ago, was 9,088. So it seems like a calm and stable situation in the sense that it's a similar number. It's slightly declined in overall hospitalizations. But this is because of the measures that we've had to take together to support one another in this pandemic. The decision I'll be reporting on later to delay certain surgeries, for example. So the situation is being managed, but it is not in a good way when you have to make the kinds of decisions we've had to make. As you'll know, as I reported yesterday, 32 people in ICU in the Northern Health Authority have been transferred to the Vancouver Island Health Authority, Fraser Health, or Vancouver Coastal Health. 26 of them are COVID patients in critical care, and none of those 26 is fully vaccinated. That's the reality of the situation. And so all of these steps are being taken to ensure that our acute care system can respond appropriately to all of the things it needs to respond to. That's the overall question. In critical care, as you know, there's 510 base critical care beds in our province, which is a significant number of beds, of course. There are 218 surge beds for a total of 728 critical care beds in our province. And just to put that in context, today, we have approximately 467 people in total. That's not with COVID-19, in total in critical care. And that is a significant number, and it's not too dissimilar to the number that were in critical care on September 3rd, which is 446. But of course, a very significant number of those, and we'll be announcing them later, are in critical care with COVID-19, and 120 of those are unvaccinated in critical care with COVID-19, a position and a situation of high risk. It is obviously not desirable to be deferring surgeries and other procedures in our healthcare system to deal with the situation. And the message in these numbers, which have been consistent, is that we will continue using the plans that we've made public and in September 2020, to continue to manage our healthcare system to ensure care can be provided for everybody. But the one thing we can all do, the one thing we can do to help in our healthcare system is to get vaccinated, and to get vaccinated today. Last week I reported that pressures from COVID-19 had caused additional postponement of non-urgent scheduled surgeries in several health authorities. And a number of hospitals continue to postpone surgeries. That means from September 26th to October 2nd, the health authorities postponed 241 non-urgent scheduled surgeries. That was 16 in Fraser Health, 56 in Interior Health, 1 in Northern Health, 11 in Vancouver Coastal Health, and 157 in Vancouver Island Health. From September 5th to October 2nd, cumulatively, there have been 1,384 surgical postponements. That said, surgeries are continuing. You'll see the dramatic difference in these numbers compared to the suspension of non-urgent scheduled surgeries in the first wave of the pandemic. So from September 12th to September 18th, health authorities completed, with all of this going on, 6,530 surgeries, which is, I think, an extraordinary effort by everyone in the health system. Last week, I reiterated our commitment to every patient who have had their surgeries delayed, that they will soon receive a phone call to reschedule their surgeries. Every one of these surgeries is important, and we all need to do our part. Just to report on some of the details, in Interior Health, Royal Inland Hospital will resume non-urgent scheduled surgeries this week, meaning that Royal Inland, Kelowna General, Penticton Regional, and Vernon Jubilee hospitals are resuming non-urgent surgeries. In Fraser Health, also this week, Surrey Memorial Hospital will resume non-urgent surgeries in a second operating room, fully restoring all surgeries at that hospital. As we've said throughout the pandemic, the people we're relying on to deliver surgeries are in equal and greater measure counting on us, on all of us, to stop the spread so they can do their critical work. And so I want to just say finally, my continuing appreciation to everybody working in our public healthcare system and to everyone in BC. We are making progress, and we need to keep building on the momentum of vaccination in our province. The community that's seen the largest increase in the last month, in the month of September, was Fort St. John, the largest percentage increase in its vaccination rate. And I applaud those efforts, and obviously at 72% we want them to continue, but those have been significant efforts. We are making progress, and we can continue to do so. But it is important, it is critical, it is essential to get vaccinated now. And I encourage everyone in British Columbia, again, to do so. And with that, we're happy to take your questions.
Thank you. A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. For the first question, we go to Vaughn Palmer, Vancouver Sun.
Good afternoon. Thank you for the briefing. Emphasizing again today in the information we're being given of the problem in northern and northeastern British Columbia. BC Hydro reported last week it's had 2 major outbreaks at Site C this year, and the majority of the cases were among the unvaccinated. Hydro also says that a significant share of its workforce rotates in and out of British Columbia from Alberta. Should Hydro be making it mandatory to be double vaccinated to work at Site C as a way of helping contain the problem in northeastern BC?
The short answer from my perspective as provincial health officer is absolutely yes. We have been working with my teams in Northern Health, the public health teams. Dr. Jung and Jung Kim and our team have been working with Site C all along. We had some challenges with a number of the large industrial camps over last winter and put in measures and worked with them. They have very strong medical support on site now and have had for the last year. But yes, these continue, and it started in the summer. We've had reports from Northern Health. We've put in additional orders for the industrial camps that require reporting of vaccination status of workers, but it's not high enough, and that is contributing to some of the surge that we're seeing in communities. It's also contributing to challenges in workers becoming sick, particularly in the congregate living settings that they're in the industrial camps. So I have written a letter to all of the employers in the large industrial camps, particularly in the north, saying that it is my very strong recommendation that they make it a requirement, particularly of living in the communal living settings that they have in the industrial camps.
Yeah, just to add, Vaughn, because the detailed information gives a sense of that. There was an outbreak declared on August 18, 2021 at Site C. There are currently 15 active cases at that outbreak. The situation is stable. Just so we understand, 3,575 doses have been administered on site. That's 1,985 first doses and 1,590 second doses. The immunization rates of the workers, of the 2,000 workers reporting to date, is 83% fully vaccinated, 7% partially vaccinated, 5% unvaccinated, and 5% not disclosed. We've been making progress there. And as of October 1st, there are 1,687 workers in camp. The short answer is we're encouraging everyone to go this route. It's important. And obviously, Crown corporations are not the public service, as you'll understand, but we're encouraging everyone in BC to get vaccinated and encouraging our leaders in BC, whether in whatever part of the business sector, public or private, to encourage these efforts as well.
Vaughn, do you have a follow-up?
Yes, please. You've said several times that employers have a right to make vaccination a requirement to work. Where employers have not done that, how much leeway do employees have to refuse to work alongside the unvaccinated?
Yeah, I'm not sure I'm qualified as to answer those questions, I'm afraid. Those are part of labor relations and labor laws. I know there is good advice that WorkSafe BC has put up that the Ministry of Labour has pulled together for employers to answer those specific questions. But it is an important consideration that you do have a requirement to have a safe workplace. And what we're seeing right now with the strain of the virus that's circulating is it can be transmitted very rapidly. And that risk goes down dramatically when everybody in that setting is vaccinated. So it is an important worker safety issue. But for the technical advice on how that plays out within an individual workplace, I would refer people to WorkSafe BC. They have some great information there for employers.
For the next question, we go to Richard Zussman, Global News.
Dr. Henry, you've obviously mentioned that the public service is now required to be vaccinated starting in November. Many of those workers work in controlled environments, workplaces. We anticipate they already have a high rate of immunization within that environment. In a school setting, teachers are mainly working with those who are not immunized in the elementary system all the way up until 12. Why not send out a provincial purview to require immunization for schools? And if not that, what is your expectation? Are you concerned that some districts with lower rates of immunization will not do it themselves because it would mean there would be far too many in the system not immunized or not being able to work because of the mandate?
Yeah, that's a very good question. And these are obviously things that we've been talking through and thinking through quite a lot. And so as I've said several times, public health orders require certain conditions to be in place. I have to have reasonable and probable grounds to believe there's a health hazard. And there is that in a healthcare setting. And that's why we've focused on the areas where an order is needed in a healthcare setting. So it is a different situation in many other settings, including industrial camps, including absolutely schools. So we have been talking with the Ministry of Education, with union representatives, with our committee that we have, our school committee, and I know that the Minister of Education is looking at how to do this, or how these issues can be addressed in an inclusive provincial perspective. And I don't know, Minister, if you wanted to talk to that, because I know there's been some ongoing discussions.
Yeah, thank you very much for the question, Richard. As Dr. Henry has said, the vaccine mandates by public health order are healthcare, and they relate to healthcare. And of course, there are hundreds of people in the hundreds of thousands working in healthcare, including 50,000 who will see that order put in place on October 12th. We know there is a desire expressed by people in school communities for mandates in education, and as such, the Education Ministry, my colleague, Minister of Education Jennifer Whiteside, is immediately convening an advisory committee, an ad hoc one with BCPC and other partners, to develop common principles, standards, and guidelines to support boards with the potential implementation of vaccine mandates. The committee will work quickly to get these materials to boards as soon as possible. If boards wish to explore a vaccine policy independently, we would strongly encourage them to work with BCPC and their local partners. In other words, that work is going on. In the direct public service, the direct employees of the public service agency, and this is a direction from the Deputy Minister, the head of the public service, Laurie Wanamaker. This has been put in place where we are direct employers, and we put this measure in place. I think it's an important measure to make people safe, and we're encouraging everybody in every possible way to get vaccinated.
Richard, do you have a follow-up?
I do. You provided, obviously, the numbers today on long-term care staff that are immunized. Do we have any sense about what that is like for the larger healthcare system? Are we worried about how many workers may not be able to work come October 26th in that case? And I know you've made a bunch of changes today. Was that to try to avoid losing a number of workers on October 14th in long-term care and assisted living?
It really was an evolution of the intent of the orders, and the intent of the orders is, of course, to provide the best protection through vaccination that we can, both for workers themselves, so that we can keep the care system going, but also for those we care for who are more vulnerable to severe illness. So we don't want to penalize somebody if they've made that correct decision, the best decision to be vaccinated. So it is putting in place the provisions that are supporting people, that it's not too late to get vaccinated. and to be able to continue to work with additional precautions and testing, et cetera, in place. And if we look at the broader healthcare sector, those orders are under development. There's a consultation process that we do with HEABC, with the unions, with the health authorities, et cetera, the colleges of physicians and nurses and pharmacists and others who are affected. So those are in their final stages as well, and will be coming out in the next few days and be posted so people can see the details there. But really it is, we don't have the same degree of information, but we have some good, strong numbers from some of the areas in the broader health sector, and we expect that we're going to see very strong, positive numbers similar to what we're seeing for long-term care. So yes, it is supporting people, cajoling people, ensuring that they have all of the information that they need to make that right decision as we head towards both the 12th and the 26th.
For the next question, we go to Mike Hager, Globe and Mail.
I just want to follow up on that staffing concern. Can you just further explain why the deadline was extended for the second dose? Is that a real concern in long-term care and assisted living, given workers are hard to come by in the best of times?
Well, it's always supporting, and we haven't extended the deadline. The deadline is still the 12th, but what we've done is made sure that people are not penalized if they've had their first dose and are committed to getting their second dose, and so that will be official. And it really puts it in line with what we were doing for new hires and other. So, but yes, it is because we know that we have a very limited healthcare resource, that we are supporting people to get immunized, to make sure that they continue to provide the care that they've done so well through this last year and a half. And yes, it's to make sure that every facility, every resident is still able to get the care they need. And we've been putting in contingency plans to make sure that that will continue. So it has been a huge endeavor, and I can't say how appreciative I am, I can't say enough how appreciative I am of all of the healthcare workers in long-term care and acute care who've been supporting each other as we've worked through all of the issues that people have on this really important issue. But it is the most important thing that we can do to protect residents, to protect patients, to protect each other as we head into this respiratory season. Don't know if you want to add more.
And just to be clear, I mean, 96% first dose immunization is very good. We've seen in the last number of weeks in the hundreds of new healthcare workers in long-term care and assisted living get vaccinated, and that's really important when you consider the relatively small number of people, the 4% who are currently unvaccinated. And so what this change does is it says to everyone who is unvaccinated in working in long-term care assisted living this week that they can get vaccinated and continue to work with the provisions put in place by Dr. Henry following October the 12th. So the deadline is the deadline to get vaccinated. That will continue to be the case, and I'm very encouraged as we do work facility by facility that we can continue to move those numbers up, because there's something that's better than 96%, it's 97% and 98% and 99%, and that's where we want to continue to push over the next week.
Mike, do you have a follow-up?
Oh, thank you. The Minister of Health referenced, more numbers coming out later this week. Can you just give us a sense of the percentage of broader healthcare workers that are fully vaccinated, and just how the resourcing will be, the resources will be reallocated once that other deadline hits, and if there are shortages?
I can't give you those numbers in exactly right now. That's the work that's ongoing in the health authorities. We know, for example, that at least 97% of physicians in the province, from Doctors of BC who've been talking to physicians, are immunized, and we know that that continues, and it continues facility by facility through the health authorities in particular, but in many of the community-based organizations as well. And I think that's important. The orders for acute care and community care are very inclusive. It is anybody who is an employee of a health authority or a contracted facility. So it essentially includes healthcare workers who work in settings outside of a hospital, outside of a community center. So if you're a healthcare worker from PHSA, for example, who works in the correctional facility, it will cover you. So I think people have been waiting to look at what the scope is, and I've been very clear from the beginning that includes all healthcare workers in all of the settings in the community and in facilities across the province. And I believe that will be an incentive to get that up. But we have a system that it records employee immunization, and so the health authorities are working on that right now to try and determine how many people are vaccinated in different programs. So I don't have those numbers right now, and I don't know, Minister, if you do at the moment.
But I just say, like that, the 96% number is based on 46,000 people. They're actuals. It's not a survey. It's not anything else. It's actuals. And I think that would be reflective of the broader system, and we'll be reporting on the numbers through acute care and in the community in the coming weeks. We're obviously focused in the next number of days to ensure that we get the complete picture, and we work with individual facilities, because as you know, at 96%, there are facilities that are above that, and inevitably facilities that are below. And so we'll be doing a lot of work in the next few weeks to raise those numbers everywhere and in every community across BC. Just to say, though, that 96% of this very large group of healthcare workers across the spectrum of healthcare in long-term care and assisted living is a pretty good indication of where we sit in healthcare. We're at 88%, we're at about 89% of all adults, then that puts us at 96% above that, and you see it across the regions where healthcare workers are significantly above the regional average in every region in the province as well. So I think that this sample of 46,000 workers is a pretty good indication.
For the next question, we go to Rob Buffum, CTV Vancouver Island.
Oh, hi. Thanks for taking my question. My first question is, the First Nations Health Authority is calling for booster shots for members of First Nations, particularly perhaps after a recent outbreak amongst the Hausut First Nation. I'm wondering, what's your reaction to that, and what is the likelihood that we will see First Nations communities prioritized for a booster shot?
Yeah, so the FNHA and we're working very closely on this whole issue. There's a number of things around booster shots, and we've made the first decision based on the advice from the National Advisory Committee on Immunization, looking at timing, et cetera, around residents of long-term care. But we are also looking at what other populations should be prioritized for a booster shot, who's it needed in, what are the parameters that we're going to use, and why would we do it. So there's a couple of things that we're looking at. One is people who were immunized earliest and with shorter intervals. Things we've learned are that the longer interval gives you stronger and longer lasting protection, which is good news for most people in BC, but there's some communities that receive their vaccine at the shorter interval. So those are all things that we're working through, and we're working through the data on whether it's needed. I will say that there are a number of First Nations communities across BC right now, particularly in the north, but also in all of the areas, the health authorities, where we prioritize vaccination, and we had really good uptake, particularly in seniors and elders. And it made a huge difference in blunting our second and our third waves. But we are now seeing that leveled off. So the number one priority for all of us in communities. I've had the privilege of speaking with First Nations leaders across the province a couple of times, and again I will this afternoon. The First Nations Health Authority is to get everybody vaccinated. So we still have rates that are below the average in the province in a number of communities, and we're seeing transmission, leading to severe illness in people who are not vaccinated, leading to hospitalizations, and sadly we've seen some deaths. So the most important thing that we are all working on right now is getting everybody with their 2 doses. And yes, we are looking at whether booster dose is needed across the board, not only for Indigenous peoples here in BC, but across Canada. So we're sharing data with our counterparts with the Indigenous Services Canada. So all of these things are under consideration. In some communities where we are seeing a lot of transmission and breakthrough infections as an outbreak management tool, like we do in long-term care, there may be an occasion to offer a 3rd dose in those communities. But those are all things that we're doing, working with leaders and health leaders on the ground for each community.
और इख्तिताम पर आपको बताएं कि ओंटारियो के चीफ मेडिकल ऑफिसर हेल्थ डॉक्टर कैरन मॉर ने मंगल को बताया था कि सूबे के स्कूलों के बच्चों की देखभाल की जगहों पर एक टारगेटेड कोविड-19 रैपिड एंटीजन टेस्टिंग प्रोग्राम शुरू हो रहा है। उन्होंने कहा कि गैर हिफाजती, गैर अलामात तलबा और बच्चों के लिए होगा। ये मकामी मेडिकल अफसरान पर मुनहसर होगा और वो इस बात का तयन करेंगे कि टेस्ट दस्तयाब हैं या नहीं। स्क्रीनिंग रज़ाकाराना तौर पर की जाएगी इस सिलसिले में। और साथ ही ये भी बताया गया है कि वालिदैन भी इस बात में अपना किरदार अदा कर सकते हैं, यानी वो भी इस मुहिम के अंदर शामिल हो सकते हैं। और मुहिम का बुनियादी मकसद यही है कि लोगों को ज़्यादा से ज़्यादा वैक्सीनेट किया जाए रैपिड एंटीजन टेस्ट के ज़रिए। और उन्होंने ये भी कहा कि वैक्सीन की तासीर और गलत मुस्बत टेस्ट के नतीजे में सीखने में भी रुकावट से पैदा होने वाले ख़तरात को हमें ख़त्म करना होगा, ताकि लोग जो भी टेस्ट करवा रहे हैं वो सही मायनों में सही रिपोर्ट हासिल कर सकें। ये भी बताया गया है कि इसमें मुख्तलिफ अवामिल हैं जिन पर तबादला ख्याल हो चुका है और मकामी मेडिकल ऑफिसर्स स्कूलों और बच्चों की देखभाल की जगहों पर तेज़ी से जांच शुरू करने के लिए इस्तेमाल होने वाले इक्विपमेंट से कह सकते हैं कि इक्विप्ड हैं। उन्होंने कहा कि आसपास की कम्युनिटी में कोविड-19 सरगर्मी की सतह या केसेस या वबा के बढ़ने के जवाब में मजीद इक़दाम की ज़रूरत आगे होगी। वालिदैन के हवाले से बताया गया कि वालिदैन के ग्रुपों ने रैपिड टेस्ट किट्स का इस्तेमाल करते हुए अपने स्कूलों के लिए निगरानी की जांच का एहतमाम किया था, लेकिन हुकूमत ने जो दीगर इदारे हैं उनसे कहा है कि वो कारोबार के अलावा किसी को भी तकसीम करना ये बंद कर दें। ये जो एंटीजन टेस्ट के हवाले से जो किट्स हैं और ये बच्चों के पॉइंट ऑफ व्यू से इसको ज़्यादा प्रायोरिटी बेस पे इस्तेमाल किया जाना चाहिए। थैंक्स गिविंग की तातीलात और जो बाशिंदे हैं उनको ही कहा गया है कि वो एक साथ अपना वक्त ज़रूर गुजार सकते हैं, लेकिन उन्हें एहतियाती तदाबीर का इख्तियार करना होगा। यही वो सिफारिशात हैं जो इस हफ्ते के आखिर में मज़ीद क्लासीफाइड होकर आएंगी और कहा गया कि अगर एक ख़ानदान को मुकम्मल तौर पे वैक्सीन दी गई हो तो आप मास्क भी हटा सकते हैं, लेकिन अगर ख़ानदान के अफराद मुकम्मल तौर पे वैक्सीनेटेड नहीं है तो मास्क को लगाना होगा। मज़ीद ये भी कहना था कि उनका कि 100 बाहर के अफराद, 25 घर के अंदर के अफराद समाजी इज्तिमा के क़वानीन पर अमल करते हुए एक गैदरिंग का पार्ट बन सकते हैं। ओंटारियो में पीर के रोज़ 429 नए केसेस रिपोर्ट हुए थे कोविड-19 के, जिससे सूबे में मजमूई तादाद बढ़ती हुई दिखाई दे रही है। और लेकिन एक तरफ हम ये भी देख रहे हैं कि इससे जो कोविड की सूरत हाल थी उसमें बेहतरी आ रही है, क्योंकि 5,89,041 केसेस अब तक सूबे में रिपोर्ट हो चुके हैं और इन केसेस में 233 गैर हिफाजती टीकों में शुमार होते हैं। 128 को मुकम्मल वैक्सीन दी गई थी और 27 को जुज़वी तौर पर वैक्सीन दी गई थी और 41 अफराद ऐसे थे जिनकी वैक्सीनेशन की तस्दीक नहीं हो सकी, हैसियत नहीं मालूम हो सकी। सूबे में आम अस्पताल के वार्ड्स में 277 अफराद की इतलात हैं और ये बताया जा रहा है कि 155 मरीज इंतहाई निगहदाश्त में हैं। ICU में 101 अफराद वेंटिलेटर पर भी हैं। आम वार्ड्स में रहने वालों के लिए 101 गैर हिफाजती टीके लगाए गए और ये भी बताया गया कि 8 को जुज़वी तौर पर टीके लगे, जबकि 41 को मुकम्मल वैक्सीन दी गई और ICU में 75 अफराद को गैर हिफाजती टीके लगने की वजह से एडमिट किया गया है। तो ये जो गैर हिफाजती टीके थे इसमें भी जो है अब रैपिड रिस्पॉन्स के तौर पे काम किया जा रहा है और एंटीजन टेस्ट के ज़रिए भी एक चीज़ सामने आ रही है। बच्चों की खास तौर पे देखभाल हो रही है, वालिदैन के किरदार को भी सराहा जा रहा है। मज़ीद इस हवाले से क्या बातें हुई देखते हैं।
Hi everyone, thanks for joining. We're going to get started now. Today we have approximately 30 minutes, and just a reminder, one question, one follow-up. And with that, I'll turn things over to Dr. Moore.
Good morning, everyone. It's been a month since most of our students went back to school. We continue to monitor the situation closely, and I'm very pleased that our schools continue to be safe places to learn. While we are reassured that COVID-19 transmission in schools remains low, we know we need to remain vigilant and be ready to respond quickly to potential cases and outbreaks in the context of the Delta variant, especially in areas of high community transmission. COVID-19 vaccination and extensive public health measures in place remain the primary responses to prevent the introduction of transmission of the virus in school and childcare settings. While vaccines and strategies such as masking, cohorting, and daily symptom screening measures remain the best defense against COVID-19, screening and testing remain important tools in protecting against the spread of COVID-19. To further help our schools remain safe and open, the province will support the implementation of rapid antigen screening for COVID-19 in specific schools and licensed childcare settings on the direction of the local medical officer of health. This school-based program is in keeping with current provincial guidance for rapid antigen screening and based on advice from Public Health Ontario, the Ontario COVID-19 Science Advisory Table, and Ontario's Testing Strategy Expert Panel, and it's focused on screening of children in public health units with the highest risk of transmission. Where the risk of transmission is very high and vaccine coverage is low at the community or school level, this measure may provide an additional layer of protection for schools and child care centers to minimize risk of outbreaks and potential closures. Routine rapid antigen screening of fully vaccinated individuals and children is not currently recommended given the effectiveness of the COVID-19 vaccines, as well as the risks posed by the disruption of learning as the result of false positive tests. This COVID-19 rapid antigen screening for childcare and school-aged children will proceed in the following manner. Local medical officers of health will determine if rapid antigen screening will be implemented in their region to local factors and needs. Where the public health unit has identified a need for rapid antigen screening in schools or childcare settings, tests will become available. This testing would be voluntary. Parents will be able to choose if their children participate in this screening offered by their schools or licensed childcare settings. Rapid antigen screening will be used only for unvaccinated, asymptomatic students and children who are not high-risk contacts, as in participating or in an outbreak. People who are symptomatic and high-risk contacts should continue to access lab-based PCR testing at assessment centers and other specimen collection centers. Unvaccinated, asymptomatic children will be able to conduct the rapid antigen screening at home and will be provided with instructions and necessary supports. Children who receive a negative result on a rapid antigen screening test will continue in-person learning. Children who receive a positive result will be required to seek a lab-based PCR test at a local assessment center or specimen collection center and will need to isolate until the result of that lab-based PCR test is known. Targeted asymptomatic screening could help detect cases in schools earlier and reduce the risks of ongoing outbreaks and/or closures, particularly in communities across the province that have a high prevalence of active COVID-19 cases. It is another tool in our tool chest to help keep schools safe and keep students in the classroom where they thrive. I'd like to again thank Ontarians for continuing to follow public health measures and advice that is in place. And I continue to encourage everyone who has not yet to get their first or second dose of the COVID-19 vaccination to do so as soon as you can, to increase our community immunity and protect our young Ontarians who are not eligible to receive the vaccine as of yet.
तो आज कनाडा हाईलाइट से फिलहाल इतना ही। कनाडा से मुताल्लिक आपको कोई भी खबर जाननी हो तो देखते रहिए प्राइम कनाडा टीवी। मोहम्मद उमर खान को दीजिए इजाजत। अल्लाह हाफिज।